Hello everyone, welcome back to Sieglery Updates. Ever found yourself holding it during a long drive, an important meeting, or that one scene in a movie you can't pause? Today we're tackling a question that plagues us all. How safe is it to hold your pee? Is it just a mild inconvenience? Or could delaying bathroom breaks have real consequences on your health? We'll explore. What happens to your bladder and urinary system when you hold urine? Health risks like UTIs, bladder stretching, kidney issues, and more. When holding urine, it might actually be a training technique. Practical tips for relying on your body's cues, and when to see a doctor. Stick with me as we break down the science, separate myths from facts, and help you make informed choices, whether you're longingly crossing your legs or planning more mindful bathroom habits. Let's get into it. Using the restroom. Bladder or pelvic discomfort, cramps, and even painful urination afterward. Urinary tract infections, UTIs. Holding urine gives bacteria time to multiply in the bladder, increasing the risk of UTIs. Bladder stretching and dysfunction. Regularly overfilling the bladder can stretch its walls, weakening the detrusor muscles. Over time, this may make it hard to fully empty or to sense fullness properly. Pelvic floor muscle damage. Frequently retaining urine may harm pelvic muscles, including the urethral sphincter. This damage can lead to urinary leakage or incontinence. Kidney issues and stones. In severe cases, backed up urine may reach the kidneys, leading to hydronephrosis, kidney infections, or even kidney damage. Holding urine can also contribute to bladder stone formation, especially if urine stays too long. The bottom line is, holding your pee occasionally usually isn't harmful, but making it a habit can lead to serious urinary system issues. How long can you safely hold pee? So, what's considered too long? Let's break it down. A healthy adult bladder holds about 1.5 to 2 cups, roughly 400 to 500 milliliters, of urine before signaling urgency. Most sources agree it's normal to urinate every 3 to 4 hours, depending on hydration, age, and medical conditions. Holding for short periods when restroom limits are unavoidable usually isn't harmful. Once in a while is fine. But chronically delaying urination can set the stage for infections, bladder stretch, and dysfunction. In rare cases, extremely delayed urination can lead to bladder rupture. But this almost always involves additional factors like trauma, tumors, or surgery. It's not a typical everyday risk. When holding pee is actually a technique. Interestingly, bladder training can involve controlled urine delay under medical guidance. For those with overactive bladder (OAB), gradually increasing the time between bathroom visits can help reset bladder signals. Distractions like puzzles or music can help. When underlying medical issues are ruled out, doctors may recommend structured retraining, holding for 15 minutes, then increasing intervals. But a word of caution: this is only for certain conditions and must be guided by a professional. It's not advice to simply ignore your body's signals habitually. Here are practical habits to keep your bladder healthy. Urinate every 3 to 4 hours regardless of urgency. Stay hydrated, sipping fluids throughout the day, avoiding overloading at once. Relax when peeing. Sit down instead of hovering to avoid tension in the pelvic muscles. Avoid straining. Don't push when urinating as that stresses pelvic area. For urinary discomfort or frequent urges, do Kegel exercises to build pelvic floor strength. Use discretion. If you need to hold briefly, like in transit, distract yourself with a game or reading, cross legs or shift posture. Watch for warning signs: frequent pain, burning, cloudy or dark urine, blood, or lower back pain. These may warrant medical attention. Medical signs and when to see a doctor. Be sure to consult a healthcare provider if you experience pain or burning when urinating, persistent or frequent urge without much output, blood in urine, cloudy or foul-smelling urine, incomplete bladder emptying or leakage, lower back or pelvic pain, conditions like kidney disorders, enlarged prostate, pregnancy, or neurological issues. Holding urine is especially risky then. A doctor may order urinalysis/urine culture to detect infection, post-void residual tests to check how completely your bladder empties, bladder diaries, urodynamic testing, imaging, or physical exams to assess bladder control or neurological involvement. Proactive care can prevent more serious complications down the line. To wrap up our discussion, holding your pee once in a while is usually harmless. But when it becomes a routine, that's when things can go sideways. You could face uncomfortable symptoms, UTIs, bladder dysfunction, or worse. Instead, listen to your body. Stick to regular bathroom intervals. Stay hydrated. Practice healthy bathroom posture. And get medical help if something feels off. If you found this helpful, give the video a thumbs up, subscribe, and ring that notification bell so you never miss our regular updates on wellness. Drop a comment and let me know your holding it stories or questions. You're not alone. Thanks for watching, and remember, when nature calls, don't delay.